That slipped out of the spotlight really in recent months, but that doesn't mean it has disappeared. Measles cases in the U.S., including South Carolina, are rising. Thanks for joining us here at 7:30 for On Your Side tonight. I'm Jamie Bold.
And I'm Kim Anderson. The State Department of Health says this is the state's 11th case total and the 8th case just since September 25th. All the recent spike in cases originate from Spartanburg County. That's on the outskirts of the WBTV region. I want you to take a look. 7 cases were reported at 2 Spartanburg County schools in late September. And the state recently confirmed another case from a child in Greenville County.
153 students who are not vaccinated across those schools were exposed in this outbreak. Health officials in South Carolina say it's important to know why it can be so easy to catch the virus if you're not protected.
That the virus can be spread through the air when a person with measles breathes, coughs, or sneezes, but the virus can also remain active and infectious in an airspace, in any confined area, in a room, a hallway, or in a vehicle for as long as 2 hours after the sick person is gone from the area, which makes it so highly transmissible.
As of this week, 1,563 cases of measles were reported in the U.S. The cases spread among 42 states, including South Carolina. There's been 44 outbreaks reported this year alone. Nearly 90% of the confirmed cases are outbreak related.
Now this year we have seen a record number of cases. I'm going to show you 2 maps. This first one here is from October of last year, and you can see case numbers of the measles pretty low, with many states shaded gray and light blue. So gray I should say means 0. Light blue means we have fewer than 10 cases. Now let me show you a second map. This is 2025, where you can see a lot more darker shades of blue indicating those higher case numbers. And very few states are colored gray compared to last year.
The measles vaccine that is currently being used, that is available now, is the same vaccine that resulted in the successful elimination of measles from the United States 20 years ago. In fact, the measles vaccine is over 97% effective in preventing infection, meaning that the majority of people who get vaccinated get lifelong protection against measles.
This map from the CDC shows MMR vaccination rates among children during the 2023-24 school year. The light orange indicates between 90 and 94% of children were vaccinated. You can see both Carolinas fell under that category, but that percentage was more than 95% in 2020.
Well, this week, the acting CDC director called for the MMR vaccine to be split into 3 separate vaccines. The post on social media echoed similar language from President Trump last month.
This is based on what I feel the mumps, measles, and the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem.
The combination of measles, mumps, and rubella vaccine, or MMR shot, was created to help streamline the childhood immunization schedule, reduce doctor visits, and help ensure children receive full protection. The combined shot was approved in 1971 and has shown to be highly effective. Research does not show spreading out the vaccines would reduce the side effects. Let's take a look. Like fever or, of course, a mild rash, the CDC recommends children receive 2 doses of the MMR vaccine. But if the shot is broken up, children would have to get 6 separate shots instead of 2.